We've been tracking COVID-19 cases at nursing homes and assisted living facilities. The state will only tell us the percentages of homes with at least one case, but refuses to release the specific locations and exactly how many cases they have. Now we're finding that the same thing is happening with group homes scattered across our neighborhoods. These are homes for people of all ages with developmental and behavioral disabilities. KXAN investigator Arezow Doost explains people who operate these homes are worried about the virus spreading.
After repeated requests, the state now says out of more than 2,900 group homes in Texas, 14 have COVID-19 cases. Those numbers are growing, and that worries those serving this vulnerable group.
Some of our folks don't even understand what COVID is.
Doug Savine is with Rock House, which operates close to 100 group homes around the state, more than a dozen in Williamson County. The homes are geared towards people with intellectual and developmental disabilities, including autism and cerebral palsy. Each house has anywhere between 4 to 6 people. Savine says they've been pushing social distancing, hand washing, restricting visitors, and temperature checking employees.
So we have to do it through role playing, we have to do it through games, we have to do it through constantly reiterating.
Savine says his company's homes have had no cases, but he fears the numbers will keep growing since some of the people in their homes have underlying health problems. Are a lot of the individuals being pulled out by their family members because of concerns?
I would be surprised if across the state of Texas it isn't somewhere around 5 to 10% of the people went home to mom and dad out of fear or concerned.
Do you think they're getting the care that they need during this COVID-19 pandemic?
I don't think they have the same priority as the large long-term care facilities with similar people who are in there who also need appropriate care and attention.
Disability Rights Texas, which advocates on behalf of people with disabilities, sent this letter to the Texas Health and Human Services Commission asking for increased pay and health care coverage for group home workers. Providers say they're having a hard time keeping employees.
They have modified some of the training requirements and certification requirements for people to come in and provide direct supports in the facility. And some of that has happened in the group homes, but it could go further.
Savine's group has already had to close 6 homes across the state because families taking their loved ones out and a shortage of workers. The advocacy group says the state also needs to help these homes get protective gear. That's something Savine says he's having a problem getting, masks and gowns, for when and if the virus hits one of his homes. Arezow Doost, KXAN investigates.